I'm here with our wonderful optometrist Raoul, and we're from Eagle Eye Surgeons in Sydney.
Nice.
So today we're going to have a bit of a chat about Presbyond, and we're going to talk about trying to dispel some of the recent myths we've heard in the community about Presbyond.
Yep, so we've actually learnt a lot about Presbyond in the last couple of weeks, but what exactly is Presbyond?
Yeah, so look, Presbyond is a special type of LASIK eye surgery. It's aimed at 40 to 60 year olds. And what we do in Presbyond is it's a form of laser blended vision. So we find out which eye is the dominant and non-dominant eye. In the dominant eye, we correct for distance vision up to intermediate, which is our computer reading vision. And in the non-dominant eye, we correct from the computer vision, so intermediate, up to near. And then there's blended zones between the two eyes, so we get that full range of vision from distance, intermediate, and near. Presbyond was invented by Professor Dan Reinstein, and he resides in the UK, and it uses the latest Zeiss refractive laser suite. So we use the MIL90 laser and the VisuMax 800, and we are able to offer this. We're the only clinic that's able to offer this in Sydney.
Okay, you mentioned dominant and non-dominant eye. How does this differ to conventional monovision laser?
Yeah, good question, Raoul. Yeah. So look, it's different to monovision because with monovision, in your dominant eye, it's set for distance, and in your non-dominant eye, we set it for a certain near distance.
Right.
So whether it's here or here, we set that range, but it's one range, okay? Whereas with laser blended vision, we have blended zones, so we're actually incorporating that intermediate or that middle vision that you just don't get with monovision.
Right.
So Presbyond uses higher order aberrations, so it uses what's called spherical aberrations, and it optimizes those. And the purpose of those is to increase our depth of field. So what Presbyond has that monovision doesn't have, if it has that depth of field, it has that blended zone, which means that for activities like tennis or golf, you get that range of vision that you want, which monovision just doesn't give. And like we also can offer monovision here at Eagle Eyes. We have the facilities to do both.
Yeah,
but I do find that our active 50-year-olds that are still playing a lot of tennis or golf really do like Presbyond because it does give them that range of vision, which they seem to not be as happy with the monovision.
Okay, that makes sense. So now we know that Presbyond really treats the corneal interface, but why hasn't it really been around if it's such an amazing treatment for the 40 to 60 year old age?
Yeah, sure. Look, it has been around.
Yeah.
It's actually very, very well known in Europe and some parts of the US. So it's been around for quite a long time. It's been around for over a decade. And it's just that different technologies are adapted at different times in different countries. And you do need certain lasers to do Presbyond. So we have the correct laser suites, the Zeiss laser suite that we can do with that. And other people don't necessarily have that laser suite. So I think it's a product of timing, the country that you're in, and the equipment, having accessibility to the equipment.
Right. What's the recovery time like after the procedure?
Yeah. So with Presbyond, like most standard forms of LASIK, you have a very quick visual recovery. The difference is that with Presbyond, there is a period of neuroadaptation. So what that means is there is a period of time where the brain has to learn to work with this new blended vision. And if you think of it like if you've got a hip replacement and you need crutches afterwards, I tell patients that have Presbyond, your eyes are a bit different, then they need to undergo a healing process. This could take weeks to months.
Yeah.
Having said that, they'll still have very good vision. It might just be for certain activities. They may find that it's just not as clear, and there is a period where they have to blink a few times for the brain to readapt. When they do adapt, it's generally a very quick turnaround. So they literally wake up one day and they've adapted.
Yeah, overnight sort of thing.
It's funny, but yeah, overnight.
It's interesting how the brain works. Yeah. And you mentioned Presbyond, and just touching base on refractive lens exchange and the differences of refractive lens exchange versus Presbyond.
Yeah.
And which one is more suited for which category or demographic?
Yeah, sure. So as I said, we're looking at the moment at the mid 40s to 60 age group. This is our presbyopic age group. So this is the age group that's got that near vision loss. That's what presbyopia is. And at Eagle Eye Surgeons, we can offer the whole suite of options for our patients. So Presbyond is our corneal or our front of the eye based option. Refractive lens exchange is our lens approach. Okay, so we can do both for our patients, and I think that there's pros and cons to both options. So with Presbyond, because it is on the surface of the eye, it's less invasive because we're not actually doing intraocular or inside the eye surgery. So the risk of things like retinal detachment or extremely serious eye infections, which are very unusual, it's lower.
Yeah.
Okay? So that's one obvious advantage. Having said that, with the refractive lens exchange, as we approach our 60s or 70s, and if we go on to develop cataract, if we've already had the refractive lens exchange, we've already replaced our natural lens. So we're not having that second operation later in life. And then there's obviously the whole discussion, and we have this with our patients, about the different lens options. So, some of the lens options, like a trifocal lens where you do get that full range of vision, they do have some side effects.
Yeah.
So patients do generally get glare and halos at night. With Presbyond, you don't really get that much glare and halos because, unlike standard LASIK, we're optimizing spherical aberrations. So we do find that the glare and halo profile at night is much less than that of standard LASIK.
So Dr. Erica, we've had Presbyond, we're in our 50s, and 20 years later we develop a cataract.
Mm-hmm.
What happens now?
Yeah, sure. So what we do is we do cataract surgery.
Yep.
The beauty of it is that we've already put that blended vision profile in the cornea, in the front of the eye. So all we need to do now is do standard cataract surgery and just put in a standard monofocal lens,
Yep.
which just corrects for one distance because we already have that profile in the cornea. So we do avoid any issues that patients may experience with some of the more specialized lenses.